Hi, you guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, Q banks, flashcards, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know I always like to go over my disclaimer and reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any other questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a 65-year-old male presents for a routine eye exam. On examination, you observe a grayish or white ring at the periphery of the cornea in both eyes. The patient has no history of significant eye problems and his vision is normal. What is the most likely diagnosis? Is it A, cataracts, B, arcus C, corneal ulcer, or D, glaucoma? Take a moment and tell me what you got in the comments, you guys. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what's being asked of you, right? So here the stem of the question states, what is the most likely diagnosis? So, I always tell y'all, if the question is asking for the diagnosis, you got to run it back and look at those assessment findings. So we have a 65-year-old male. He's having a routine eye exam, and on exam, it's noted that he has a grayish white ring around the cornea of his eye. This is classic for arcus, right? So B is your best answer. Question number two. A 72-year-old female is noted to have a grayish white ring at the edge of her corneas during an eye exam. She has a history of hypertension and diabetes. Given the findings, what additional tests would be most appropriate to assess her risk of cardiovascular disease? Is it A, a CBC, B, serum cholesterol and triglyceride levels, C, a liver function test, or D, an A1C and fasting glucose levels? Take a moment and tell me what you got. All right, so stem of the question states, given the findings, what additional tests would be most appropriate to assess her risk of cardiovascular disease? Y'all, I'm laughing at myself because you know what? I know I just thought about that. I do that often. I just start singing, tell me what you got. Y'all, that's my randomness. Forgive me. But this stem of the question states, given the findings, what additional test would be most appropriate to assess her risk of cardiovascular disease? All right, so what do we have going on? 72-year-old lady has a grayish white ring around her corneas on the eye exam. She does have a history of hypertension and diabetes, but we know that this again is a key identifier for arcus, right? So with arcus, one thing that we also want to review is the lipid panel, right? The cholesterol, the triglycerides, right? So your best answer here is B. And then lastly, question number three, a 60-year-old male with no significant medical history presents with arcus in both eyes, which was detected during an eye exam. He is concerned about his eye health. What is the most appropriate course of action? Is it A, no treatment is necessary, educate the patient that arcus is a normal aging change? B, refer to an ophthalmologist for immediate intervention? C, prescribe a topical steroid for the corneal changes? Or D, recommend surgery to remove the deposits on the cornea? Tell me what you got, you guys. All right, so stem of the question here states, what is the most appropriate course of action? So what do we have going on? So we have a 60-year-old male, no significant medical history, but he has arcus bilaterally, right? So what do we want to educate them on this? So this is why I also tell y'all, when you're walking yourself through, pay attention to the age, the gender, the ethnicity, because this can contribute to how you treat, how you diagnose, etc., right? So here, this is a 60-year-old male. 60-year-old, right? So there's no treatment necessary because 60 and older with arcus, this can be found as a normal finding due to aging, right? Whereas if it would have said that this patient was 40, Then it's abnormal. We need to correct that cholesterol levels because that's most likely the source and the cause, okay? So here, the best answer is A, no treatment is necessary. Educate the patient that Arcasinellis is a normal aging change. But again, be sure that you're not reading so quickly and missing how old they're telling you this patient is in the HPI and missing key identification to answer this appropriately. So slow down and walk yourself through, okay? All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any other resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to thenursinstudio1@gmail.com. All of the things that I do offer are linked in the bio of the channel, including my website, so that you can find any of the resources that you may need. And as always, if you're looking to book a one-on-one session with me, I always say either call, text, or email, as I offer a variety of one-on-one session types, and I prefer speaking with you to gauge what you truly need to make sure you're booking the appropriate session. All right, you guys, y'all know what to do. Make sure you meet me back here. Happy studying. Bye, y'all.